Hi everyone, and welcome to the presentation about the coronavirus COVID-19. I want to mention that this presentation has some information that is specific to Greece. So first I want to start out by saying, what is coronavirus? So coronaviruses are a family of viruses. There are many of them. The name corona means crown because coronavirus looks like a crown under the microscope, and you can see in the picture a coronavirus. So viruses that are coronaviruses cause the common cold, other mild respiratory diseases, and also some animal diseases. The virus that we're talking about today in the world is COVID-19, or also known as SARS-CoV-2. This virus jumped from an animal to a human, and it was never before seen in humans. Much is still unknown about COVID-19. So when did this start? So COVID-19 was first seen in humans in December 2019 in the city Wuhan in China. The virus is currently spreading around the world. The highest number of cases are in the United States, in Spain, and in Italy. So what is the situation in Greece? So this presentation was updated on April 28th. Currently, there are 2,534 confirmed cases in Greece. 577 people have recovered, and 136 people, unfortunately, have died from the virus. So how does the virus spread? COVID-19 spreads between people through tiny droplets, like in the picture. So another person with the virus sneezes or coughs, and you breathe in these drops, and you can get the virus. Also, the virus lives on surfaces. So if a person with the virus touches a surface, and then you touch the surface, and then you touch your mouth, nose, or eyes, you can get the virus this way. For example, on phones or on a doorknob or on the bus, if you touch something with the virus, you can get it this way. What are the symptoms of COVID-19? So usually once people are exposed to the virus, 2 to 14 days later, they can have some symptoms. These symptoms can include fever, cough, feeling tired or feeling unwell, having trouble breathing, or having muscle aches. Some people have no symptoms. Every person has a different response to the virus. How bad is COVID-19, or how severe is it? So actually more than 80% of people have only mild symptoms and can recover at home. 14% of people with the virus have severe symptoms like pneumonia or trouble breathing. 5% of people with the virus have very severe symptoms and need to be treated in the hospital. Around 2 to 3% who have the virus unfortunately die from the virus, but this may be lower. Why could this be lower? Because some people have no symptoms from the virus. So there are people who may have been exposed to the virus and they don't know that they have the virus. So maybe the percent of people with the virus who have mild symptoms is even higher, which means the percent of people who have died from the virus is lower. But who are the people who have more severe forms of the disease? These people are older people, over age 65, or people with other health conditions like high blood pressure, heart disease, lung disease, diabetes, people who are on medications that make their immune systems weaker. These people are at higher risk to have a severe form of the disease. The good thing about this virus is that usually children have mild or no symptoms even, but children can still spread the virus if they have it. So what should you do if you have symptoms? If you live in Greece, there is a number you can call. There is a hotline. It is 1135, or you can call 210-521-2054. Both of these numbers are the same, and if you live in Greece and you have any symptoms, you can call them and they can give you advice about what to do. So now we will talk about different ways to prevent getting the virus. First, and very important, is washing your hands with soap and water often. You can also use hand sanitizer or alcohol, but if you use alcohol, it's very important that it's over 60% alcohol. It needs to say over 60% on the package or a higher percent. It's very important to wash your hands, especially after being outside and after touching other people or surfaces. For example, if you touch a doorknob or you're on the bus and you touch something on the bus, it's very important that you wash your hands. Also, try to avoid touching your face with your hands, especially your mouth, nose, or eyes. So try to keep your hands away from your face. If you cough or sneeze, it's also important to cover your cough or sneeze with your elbow or with a tissue and then throw the tissue in the trash so you don't spread anything to other people. Other things that are important for prevention: first, stay home as much as possible. Only leave home if it's absolutely necessary. And some people don't have a home right now, and for those people, they can do their best to just try to stay away from people as much as possible. Try to avoid being in crowds, things like this. It's very important to stay at least 2 meters away from people who you're not living with. So this distance is farther than you think, but they say 2 meters away at least from another person. You want to try to stay very far away from people who are sick, especially, such as people who are coughing. You can wear a mask or scarf over your mouth and nose if you want. It's very important to do this, especially if you are sick, but also if you are not sick, you can wear this. And then finally, you want to clean objects and surfaces that you touch frequently using a cleaning spray or a cleaning wipe. Very important to clean more than you usually do. Now I want to talk about proper hand washing. So the first step for hand washing is you want to wet your hands with clean water. You want to try to not touch the handle of the sink with your hand. Try to use your arm if you can. Then you apply soap. You want to rub your hands together with the soap, especially the backs of your hands, between your fingers, and under your nails. You want to count at least 20 seconds that you're rubbing your hands. Try to clean your hands for more than 20 seconds. Then finally, rinse your hands with water and dry your hands using a paper towel or air dry your hands. Try not to use a regular towel. And when you turn the sink off, try not to touch the handle with your hand. These are some tips for the steps for hand washing. And also there's a very nice video that I show in this slide. I will also link it down below that you guys can watch this video that shows how to properly wash your hands. Next, I talk about treatment. So there is no medicine currently to fight the virus. The treatment for this virus is that your body fights off the virus itself. If you're only having mild symptoms, you can rest at home, drink a lot of fluids, and stay away from people. Your body will fight off the virus. For people with severe symptoms, like people who have trouble breathing, these people need to go to the hospital. There's no medicine that can help them, but they can get fluids through an IV, they can use oxygen, or they can get oxygen, and there's machines that help support breathing. It's very important in this time to try to take very good care of yourself because it's very stressful. What are some ways to do this? First, talking with others about your feelings, like your friends, family, your communities. Try not to read the news all the time because this can be very stressful. And then take good care of yourself, doing things like meditation, yoga, trying to stay active indoors, learning something new, like trying to improve your English or learning Greek, listening to music, and also sleep is very important in this time. So now, what are the main points of this presentation? As we saw, most young and healthy people will only have mild symptoms from COVID-19. But we must think as a community to protect the most vulnerable people, trying to stay home as much as possible and staying away from others, We want to stay at least 2 meters away from another person, and proper hand washing is important. So this virus isn't going away right now. So even when people start to go out again in the summer, you see more people on the streets, the virus is still out there, and we still need to try to stay away from other people, and we still want to make sure we try to wash our hands really well, trying to stay away from others who are sick, cleaning a lot. All the things we went over is very important in this time. These are the references that I used for the presentation. Thank you guys so much for listening today, and stay safe.